Answer questions 100 to 102 on the basis of the following information. You are called by the police department to a neighborhood where you encounter a male patient approximately 20 to 30 years old. The police officer states that neighbors called because the patient was freaking out. Witnesses say they saw him smoking something just before he started acting in a bizarre manner. During your assessment, you notice that the patient is hyperactive and anxious. His pupils are dilated, and he is hypertensive and tachycardic. 101. The appropriate treatment for this patient consists of oxygen for ECG monitoring and A. Transport, B. Naloxone, C. Activated charcoal, D. Syrup of ipecac. Answer: A. Transport. Explanation: transport is the only other treatment required for this patient. Be prepared to provide respiratory support if needed. Naloxone is used with narcotic ingestion to restore respirations and is not indicated in this patient. Activated charcoal and ipecac are indicated for poisoning or overdose via the oral route. This patient was reported to have inhaled, smoked, something that appears to be a stimulant. 102. When treating this patient, you should be prepared for which of the following complications? A. Tachycardia and septic shock. B. CNS depression and hypoglycemia. C. Dysrhythmias and seizures. D. Bradycardia and tachypnea. Answer: C. Dysrhythmias and seizures. Explanation: dysrhythmias and seizures are both serious possible complications of stimulation effects from cocaine use. 103. Your patient is in respiratory distress. He is exhibiting jugular venous distension. Crackles are auscultated throughout his lung fields. He is tachycardic, hypertensive, and tachypneic. Which of the following sets of treatment is indicated for this patient's presentation? A is oxygen, morphine sulfate IM, intravenous line at 30 cubic centimeters per hour and 40 milligrams furosemide 4. B. Oxygen, intravenous line at 30 cubic centimeters per hour, nitroglycerin SL, and 40 milligrams furosemide 4. C's oxygen, saline lock, and 2 milligrams morphine sulfate 4. D. Oxygen, sublingual nitroglycerin, and 40 milligrams furosemide IM. Answer: B. Oxygen, intravenous line at 30 cubic centimeters per hour, nitroglycerin SL, and 40 milligrams furosemide 4. Explanation: this patient appears to be experiencing acute pulmonary edema. Of the choices provided, option B has both the correct doses and routes of the indicated medications. 104. A patient is complaining of chest pressure and shortness of breath. He has jugular venous distension and pedal edema. His lung sounds are clear and equal. Which of the following conditions most likely cause these findings? A. Left side heart failure. B. Right side heart failure. C. Pulmonary embolus. D. Cardiac asthma. Answer: B. Right side heart failure. Explanation: reduced pumping capacity of the right ventricle causes blood flow to back up into the systemic vascular system, causing congestion as evidenced by the pedal edema and JVD. Lung fields that are past the cardiac insufficiency remain free from fluid. 105. Your patient has a suspected hand injury. How can you best immobilize the hand in the position of function? A. Tape it flat against the chest with the fingers extended outward together. B. Put the arm into a sling and swathe and allow the hand to dangle naturally. C. Place a roll of gauze bandage into the palm and secure the hand to a splint. D. Secure the hand to a padded splint with the hand clenched into a fist. Answer: C. Place a roll of gauze bandage into the palm and secure the hand to a splint. Explanation: the neutral position or position of function for the hand is achieved by using a gauze roller bandage or similar material placed inside the palm with the fingers curled around it. The hand, wrist, and forearm should then be splinted with a board, wire ladder, or vacuum-type splint. 106. When splinting a limb with a suspected fracture, one caregiver applies the splint while another A. holds the limb and monitors distal pulse, motor, and sensation. B. calms, reassures, and provides emotional support to the patient. C. checks for limb alignment and administers high-flow oxygen. D. gets the stretcher or other supplies and monitors vital signs. Answer: A. Holds the limb and monitors distal pulse, motor, and sensation. Explanation. Immobilization of a suspected fracture is best accomplished with 2 rescuers. After positioning the limb properly, one EMS provider applies the splint, while the other holds the limb in position and monitors the distal pulse, motor, and sensory responses. 107. You are caring for a patient whose finger was just cut off in an accident. What should you do with the amputated finger? A. Place the severed finger in a plastic bag and immerse the bag in cold water. B. Immerse the severed finger directly into a pail of ice-cold normal saline solution. C. Bandage the severed finger in sterile gauze and place it in a plastic bag with ice. D. Bandage the hand with the severed finger placed back into its normal position. Answer. C. Bandage the severed finger in sterile gauze and place it in a plastic bag with ice. Explanation. Do not allow the severed digit to get wet because the tissues will begin to draw in the hypotonic fluid and will swell up, which may make reimplantation impossible. The cold environment will help reduce oxygen demand by the cells of the severed digit and will help keep it alive longer. 108. Which of the following is not characteristic of a mild or moderate pit viper envenomation? A. Bruising located around the wound site. B. Systemic effects like nausea or vomiting. C. Localized edema at the wound site. D. Little or no pain felt by the patient. Answer. D. Little or no pain felt by the patient. Explanation. Pit viper envenomation is generally very painful. Little or no pain is characteristic of coral snake, neurotoxic envenomation. 109. How should you treat a patient who has sustained dry lime burns to the hand and arm? A. Use a neutralizing acid to offset the effect of the chemical burn. B. Brush the lime away and then flood the skin with cool water. C. Immediately immerse the injured limb in a pail of cold water. D. Use alcohol to dissolve the lime and then flood with cool water. Answer. B. Brush the lime away and then flood the skin with cool water. Explanation. Brush away as much of the lime as possible, then flood the burned area with water. Neutralizing chemicals are generally not recommended because the use of one chemical to neutralize another usually results in the release of heat and the formation of a third chemical. 110. A patient in a very early stage of hypoglycemia may complain of A. Drowsiness. B. Dry mouth.
C. Nausea.
D. Hunger. Answer. D. Hunger. Explanation. The earliest manifestations of hypoglycemia are hunger, anxiety, and restlessness. 111. Diabetic patients may develop hypoglycemia if they take too much insulin or if they A. Exercise too much with limited food intake. B. Overeat and do not exercise enough. C. Sit in a chair for prolonged periods of time. D. Inject their insulin directly into a vein. Answer. A. Exercise too much with limited food intake. Explanation. Hypoglycemia develops in patients with diabetes when they take too much insulin or get too much exercise for the amount of food they eat. 113. A patient is in respiratory distress. She has a valid DNR order. Which of the following treatments is correct? A. Nothing should be done to the patient in this situation. B. Provide oxygen and a nebulized albuterol treatment. C. Administer 2L of oxygen via a nasal cannula. D. Initiate a direct laryngoscopy and intubation. Answer. D. Initiate a direct laryngoscopy and intubation. Explanation. Do not resuscitate is not the same as do not treat. Under these conditions, management of the condition is warranted. 114. You have secured the airway and immobilized the cervical spine for your patient with an altered mental status. What is your next priority of care? A. Draw blood for glucose assessment and establish IN4. B. Assess DCAP-BTLS, looking for any hidden injuries. C. Administer naloxone via the 4 and IM glucagon. D. Hyperventilate with O2 and administer dexamethasone. Answer. A. Draw blood for glucose assessment and establish IN4. Explanation. The first priority for patients with altered mental status of unknown cause is a blood glucose determination to rule out hypoglycemia as a potential cause. 115. You are called to the home of a 36-year-old man who is having a seizure. His wife reports that he has not taken his seizure pills lately and that he has now had 3 seizures in a row without regaining consciousness. You have secured the airway and are now ventilating with the bag valve mask. What should you do next? A. Draw blood, administer dextrose, and transport immediately. B. Monitor blood glucose level and administer naloxone and thiamine. C. Secure the patient to a long spine board until the seizures are over. D. Begin in 4. Monitor cardiac rhythm and administer diazepam. Answer. D. Begin in 4. Monitor cardiac rhythm and administer diazepam. Explanation. For a patient in status epilepticus, treatment consists of establishing in 4, monitoring cardiac rhythm, and administering diazepam to stop the seizures. 116. What is the primary treatment for severe anaphylaxis in an adult? A. 0.3 to 0.5 milligrams of epinephrine 1:10 000 given intravenously. B. 0.1 to 0.3 milligrams of epinephrine 1:10 000 given subcutaneously. C. 0.3 to 0.5 milligrams of epinephrine 1:10 000 given intravenously. D. 0.1 to 0.3 milligrams of epinephrine 1:10 000 given subcutaneously. Answer. D. 0.1 to 0.3 milligrams of epinephrine 1:10 000 given subcutaneously. Explanation. This is the standard adult dosage and route for a patient with severe anaphylaxis. The SC route is recommended unless the patient is in life-threatening distress. Services may recommend the use of 1:10 000 instead of 1:10 000. 117. An adult patient has overdosed on an unknown medication in a suicide attempt. She is alert, oriented, and refusing treatment and transport. What is your most appropriate next action? A. Obtain a signed refusal from the patient. B. Advise the patient that she will die if not treated. C. Restrain her and transport to the emergency department. D. Consult with medical direction to transport the patient. Answer. D. Consult with medical direction to transport the patient. Explanation. This patient may not have the right to refuse treatment and transport due to the actions she has taken. Consulting with medical direction on how to best approach this patient may be helpful. 118. Which of the following patients is considered to be at high risk for a heat-related emergency? A. 29-year-old amputee. B. 48-year-old police officer. C. 17-year-old athlete. D. 78-year-old diabetic. Answer. D. 78-year-old diabetic. Explanation. The very young, the very old, those undernourished, and those with chronic illness are all predisposed to heat illnesses for a variety of reasons. 119. A late sign of hypoxia in children is A. Tachypnea. B. Hypotension. C. Tachycardia. D. Bradycardia. Answer. D. Bradycardia. Explanation. Bradycardia in a child is an ominous sign of a hypoxic brain. 120. What is the most important treatment consideration for a patient who is suffering from decompression sickness? A. Have suction equipment ready, because vomiting is common. B. Monitor the ECG and be prepared to defibrillate as necessary. C. Provide high-concentration oxygen with a non-rebreather mask. D. Administer nitronox or morphine sulfate as needed to control pain. Answer. C. Provide high-concentration oxygen with a non-rebreather mask. Explanation. Provide oxygen at 100% concentration and intubate if the patient is not breathing spontaneously.